Thanks so much. I'm Keiko McCracken, she, her pronouns, and I've had the pleasure of meeting a number of you through the orientations that I provided for the Collaborative Action Network. If you don't yet know about that and you wish to, hit me up, love to talk to you about that. But I'm actually here today to talk about another community of practice, which we are just standing up, which is about oral health. And so I'd like to just start by, if you are an oral health advocate in the audience, if your work is with oral health, could you raise your hand? And I know that there are some folks love to see that. And I'm going to tell you that in about 5 minutes, I'm going to see a whole lot more hands raised. And so let me just kind of set the scene for oral health. Preventable dental issues are at the heart of about 2 million emergency visits annually at a cost of about $2 billion a year. Roughly in this area, in our 5-county region, there is one dentist for every 1,400 community members. In Island County, there are just 2 pediatric dentists taking Apple Health. One sees children up to age 6, one sees children up to age 12. So this is just across the broad spectrum of a human's lifetime. The need for oral health is extreme. It is, in fact, in the county assessments that are produced by community actions and community health departments. It is the #1 need of community members. It exceeds housing as the most critical need for our communities that they cannot access for so many different reasons. And I will tell you that I'm a fairly recent convert, but I'm such a convert to this cause of oral health advocacy, because oral health is tied to diabetes, heart disease, stroke, and kidney disease. It's tied to opioid misuse as people try to self-medicate. So it's tied to addiction, Alzheimer's, preterm birth, and perinatal mortality. Socially, it's tied to economic well-being because dental debt is one of the leading drivers of medical debt. People who don't have access to oral health care have a harder time getting jobs because there is an absolute bias in our society toward the perfect mouth, and that absolutely affects their ability to provide for their families, provide for themselves. It just goes on and on. I have come to understand that oral health is really the proxy measure for so many other drivers of inequality in our communities, and whatever the sector that you're involved with, whether you map that through the 7 vital conditions, oral health is right there in the center of everything. It is an economic issue. It's a racial issue because BIPOC communities are far less able to access oral health care. It's a disability issue because folks with disabilities are far less likely to have access to oral health care to be accepted by a dental practice. It's an issue for rural communities, for senior citizens. It doesn't care. It's affecting so many of our friends and neighbors. And so if you are working in a system that is focused on housing, raise your hand. If you are working in a system that is focused on food justice and food access, raise your hand. If you are working in behavioral health, in mental health, if you are working with aging populations, with children and families and access in that way, raise your hand. And if I am missing any sector, I will tell you, the folks you're serving, this is just a deep and incredible need for them. Raise your hand. I want to see all of our real, this is what it takes to build change, and I invite you to help us create that container for change through joining us in the Oral Health Community of Practice. Our first meeting is January 30th at 2 o'clock. Love to see you there, and I'm just going to quote Dr. Marino when she said, the design can be a co-creation process. And this is what we hope to build, is something that, we all know that oral health is an issue. How do we solve this? How do we go beyond identifying the issue to creating fundamental change in access for our communities. And I am a huge believer in hope. And so I just want to leave you all with a few quotes about hope as well. Wendell Berry, the poet and farmer, tells us to be joyful that we have considered all of the facts. Václav Havel, the poet and dissident who became the president of the Czech Republic, tells us that hope is not prognostication. It is not a guarantee of success. Hope is an orientation of the spirit, and it is a commitment to do the right thing, to do the good thing, despite any percentage of success that might be assigned to that. Noam Chomsky, the linguist and cultural critic, tells us that when we accept what systems have defined as the container for debate and solving, when we accept those parameters, we're actually deepening the inequalities that those parameters create. And finally, I'll just end with one more person who told us during his campaign for president, yes, we can. So yes, we can. Please hit me up for oral health. I'm all about that.
Thank you, Keiko. Appreciate all of that. I do want to mention that the reason that we've actually been in the oral health space for the last 5 years has been because of some support and partnership with the Arcora Foundation, who had created these local impact networks, and they've been in partnership with us, and we just want to continue that work. There's just like so much opportunity. And then the last thing I want to say, because I'm not sure we've mentioned it yet, this is actually the first convening where we have a sponsor. We've done these convenings for now, 6 years, and we've just done it. We've been trying to create a space where you all can come together and learn and share with each other. And this convening, the Inatai Foundation decided to become a sponsor, and we just have never really thought about, this is going to sound really silly, we've never really thought about seeking sponsorships to help offset the cost of the work that we do. So we're really grateful for Inatai stepping into this space, and it's because there's a mission alignment, not just because they had funds. And so just wanted to mention that as well.